and welcome to this week's Compass Connection. My name is Molly Vance. I'm a school nurse for our district. A little bit about my experience is I started off with geriatric nursing and I worked in public health and communicable disease, and now I'm here as a school nurse with Lincoln County School District. I cover all the Newport area schools. Scott Deeker, who isn't able to be here with us today, he covers the Lincoln City schools, and his nursing background is in emergency nursing. And I'd like to introduce Crystal.
Hi, my name is Crystal Pickner, and I am newest to the district, and I cover Wellport and Toledo areas. And prior to this, I worked in neurology through Riverbend, and then I also worked for the county and school-based health centers and community health. That's been about 12 years there, and so I'm really enjoying my new position and learning all about what we're going to talk about today.
And what's exciting with all of our experiences added together is 46 years. So you may be wondering what a school nurse does. At the beginning of the school year, we look at medical needs for students and we create care plans. And so that may be a student with diabetes who requires insulin injections, tube feedings, or a student who has asthma and needs an asthma care plan for staff to know how to treat someone if they're having an attack. In addition to care plans, school nurses check off CPR skills for staff members. We also teach basic first aid for seizures and how to react to hypoglycemia if someone's blood sugar becomes really low. Another thing that we do this year that is really exciting is Tier 1 lessons. This is the first time School Nurses has been a part of this, and this means that Tier 1 means all students get the same lesson. So for example, hand washing for kindergartners, sexually transmitted infection education for 7th and 9th grade, vaping and smoking for 5th and 8th grade, and all of these lessons have the Oregon Health Education standards that are required for development of these lessons. Nurses also provide ongoing trainings with schools' health assistants. We participate in IEPs, which is individual education plans, 504 plans, as well as surveillance for disease monitoring. So what that means is if a health assistant calls us and says, hey, we noticed that there are quite a few students that are having diarrhea, we're going to look into that and see if it's something that we can help stop mitigate, and if it's something that we need to reach out to the health department for, our public health department, to help stop that spread of disease. Another thing we do is we have ongoing communication with teachers, families, students themselves, and any outside partners to help make students have healthy learning in schools. Healthy students are better learners, and we are proud to be a part of the students' and families' lives to help make this happen. Thank you for watching this week's Compass Connection, and tune in for another guest host next week. Thanks.